Did you know you can watch a show back on our own website, knowthecause.com? You need to because of this. Dr. Leland Stillman is here today to talk about, are we overdiagnosing certain diseases, maybe Lyme disease? My good friend Susie Cohen, America's Pharmacist, is here to talk about your adrenal glands. I'm going to open today's show begging the question, is COVID-19 a mutated gene disease? I mean, I can speculate, and that's what I'm going to do. Toward the end of the show, I got asked by someone on live Facebook the other day, why do you take supplements? I answer that. And then Mycosis Fungoides. Doesn't that sound like a fungus? And yet it's a cancer. Is there a similarity? All that and more. You want to play it back today.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate, and you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
And welcome aboard, friends. You know, I think this COVID-19, SARS-CoV-2, COVID-19 and cancer have a lot to do with one another. So I've studied cancer for 40 years, folks, and so let's discuss this. Let's open with this. Is COVID-19 a gene-mutating virus? Be still my heart. Many people haven't even studied this, especially scientists. I believe that SARS-CoV-2, a respiratory bat virus, converged with Histoplasma capsulata, a fungus that breaks down bird bat guano, when Wuhan virologists entered the bat caves to take feces samples from the bats to look for COVID-19. After stirring up the dirt and dust inside the caves, unbeknownst to these virologists, they returned back to the Wuhan lab covered in fungi. Genetic fusion occurs when nucleic acids, we call it DNA or RNA, from one species naturally fuse with those of another species. You know, I published, decades ago, that I thought genetic fusion was what cancer was all about, okay? Let's stay on, on this SARS, though. Dr. Fauci and others have been accused of gain-of-function experiments wherein laboratory scientists alter, amplify, and make a previously harmless organism more virulent and even deadly. But maybe they didn't have any idea, folks. That's what this is about. With few researchers, few understand, however, is that gain-of-function occurs naturally in disease-causing germs. It's called genetic fusion. So gain-of-function and genetic fusion, in one gain of function, you need a lab tech all masked up, a hood that they work under, sterile environments, a pipette, moving reagents around and so forth. But in genetic fusion, it just happens. The DNA or RNA from organisms get together just naturally. I believe this phenomenon causes human cancers when DNA from cancer-causing fungi merge with human white blood cell DNA. This fusion creates a previously never-seen hybrid organism whose parent cells are 50% of one and 50% of the other, okay? So let's study genetic fusion. I'll never forget Milton White in Detroit Hospital. I went and met with him maybe 30, 40 years ago. He said cancer is neither the result of a virus nor the consequence of an inherited gene defect. Cancer is a hybrid. It's due to a plant, Conidia spores, derived from an ascomycete or sac strain of fungus. If so, what does that fungus fuse with to make cancer occur? So he was a genius. I loved that guy. I spoke with him many times. He passed many years ago. But his wife died of breast cancer, and before he died, he told me this with tears in his eye. She said, "Milton, you're a smart man. Figure cancer out." He said that cancer is a genetic fusion, and he said plant, fungal, DNA fuses with something, but what? We get a bit of information out of Yale University back in 2013. We know that genetic fusion exists because Yale researchers said cancer metastasis is caused by genetic fusion. Here's what they said. Our results provide the first proof in humans that metastasis, cancer metastasis, can occur when a white blood cell fuse and form a genetic hybrid. when a leukocyte and a cancer cell fuse and form a genetic hybrid. Fungal infections are sometimes misdiagnosed with cancer. Folks, human white blood cells have DNA in the nucleus of the cell, right? Cancer cells have DNA. Could white blood cells and fungal cells get together and form a sac, a lump? They do. And could we be calling that sometimes erroneously cancer? Okay? Look at this. Cancer and fungus share these similarities. Each can thrive in a sac formation. Each can metabolize nutrients without any oxygen available, so that lump grows and grows and grows over time. Each generates lactic acid, a caustic substance. Each depends on their host, that's us, for sustenance, proliferation, and reproduction. Each thrive in the presence of sugar and die in the absence of sugar or carbohydrates. Both emit VOCs, volatile organic compounds. Dogs that sniff out mold can also be trained to sniff out cancer, and both respond to antifungal medications. More and more Sporanox, Lamisil, more and more antifungal drugs are now being used in cancer. Why? If cancer doesn't have a fungal component, why would they use antifungal drugs? Finally, Doug's flux capacitor. On the left, we have fungal DNA fusing with human DNA. On the right, fungal DNA and human DNA, and a brand new lump is born. And we're calling that hybrid cancer. Hope that helps, folks. You may not know Dr. Leland Stillman yet. You're going to, because we're going to have him on the show several times, nationally and internationally. My wife sent me a video of his, which now has 1 million, views. He struck a nerve when he asked America to be responsible for your own health. Folks, there's 2 ways to go: health insurance or health assurance. This doctor out of the University of Virginia, he practices in Virginia, his name is Dr. Stillman. He believes that health assurance really preempts having to have health insurance, right? Thank you, Dr. Stillman, for coming in and being with us today.
Thank you for having me. It's a pleasure to be here.
I couldn't put, she sends me 10 a day. Yours, I couldn't put down because of what you were saying, and that's pretty much we have to govern our own health. Then I went to your website and started going through your blogs. Lo and behold, here's a title: Lyme disease, a manufactured epidemic? Is this a real disease? And for decades, I've been wondering about Lyme. I think some people get bit by a tick, end up with Lyme disease, and they need therapy. But I think, in my humble opinion, we are overdiagnosing this condition. Your take on that?
I absolutely agree with you. I think it's widely overdiagnosed, and one of the problems that you run into is that the symptoms of Lyme disease are so many and various, and the presentation can be so different, where it affects one person's heart, another person's skin, another person's mind. How can you possibly come to a diagnosis without reliable laboratory testing? The problem becomes that the laboratory testing we rely on relies upon our immune system's response. And the other thing is there's a lot of bugs in the body that look like Lyme. So do you have an infection with Lyme, or do you have an immunological process of some kind where you're not tolerating one of your endogenous bacteria, one of the bacteria that's supposed to be naturally part of your healthy microbiome? This is really $1 million question that, of course, I hope people will come to a true answer of. When I approach someone who's received a diagnosis of chronic Lyme disease, my first question is this: if they ever had an infection, why did their body not clear the infection? And I like to call this the redneck paradox. I'm from Virginia. I spend a lot of time in rural Virginia. I've been privileged to take care of many people who would describe themselves as rednecks, and I can't tell you how many ticks they probably pull off of themselves every year. And yet they don't get chronic Lyme disease. When they get a bullseye rash or they get Lyme disease, they get a short course of doxycycline or another antibiotic, and it does the trick. Why does that not work for everyone? I think that the answer comes to us actually from history. If you go back and you look at a similar bacteria to Lyme disease, it's actually syphilis. If someone has a compromised immune system and they have syphilis, the antibiotics may not actually knock out the infection. So people think that antibiotics are the answer to infection, but the reality is if your immune system does not work, you cannot rely on antibiotics. And that's why In my career, I've met many patients who were on antibiotics for chronic Lyme disease for long periods of time and not getting better. And they would go off the antibiotics and they would often get worse. And I call this the antibiotic Ferris wheel. And they have no idea where the bottom is, and they want desperately to get off. But until you fix the underlying problems in the patient's immune system and metabolism, then you shouldn't rely on the patient's immune system to do the job that it ought to do. And these are the people who I find invariably relapse into their disease. And the other piece of that has to do with their environment. They've got to have a healthy lifestyle to go with a healthy diet. They've got to be getting time outside. They've got to be getting sun. And one of my observations from early on in my career treating people with chronic Lyme was that the people who didn't get better were from very urban zip codes, and they were very reliant on technology, particularly young kids who never saw the sun, never played outside, were always inside on some kind of tech device, which is why nature is really a big part of my prescription, and I would say a much bigger part of mine than many of my natural medical colleagues.
And that makes so much sense, because vitamin D, you know,
Exactly.
It's so important, folks, that you understand. And this is a doctor who doesn't say, okay, take 5,000 IU vitamin D a day, D3. Rather, he says, give me a tube of blood. Let me make certain. These doctors, in my humble opinion, are very rare. Dr. Stillman does things a little bit differently. When I watched the tape that he was on that now has, 500,000, 1 million hits, he went viral, if you will. He's very compassionate toward these patients, and he's a scientist. Don't just throw things in your body. Let me make certain. Don't just say you have Lyme. Let me make certain you do. Dr. Stillman, thank you so much. Love you being on.
Thank you.
Thank you.
Hi, I'm Susie Cohen, America's Pharmacist. 2 tiny grape-sized glands are your body's workhorse for producing the hormones that wake you up and give you energy. I'm talking about your adrenal glands. So if you're tired, or you feel like you can't cope as well as you should, or if you have unexplained aches and pains, low blood pressure, or lightheadedness, you might have a condition called adrenal fatigue. It's caused by chronic stress, and your body simply cannot keep up with a continual fight or flight response. So job number 1 is to lower your stress level. I don't care how you do it, just do it. Change your phone number if you have to. Try meditation, dancing, gardening, scrapbooking, anything that makes you happy. And then there's always Schisandra, a natural herb that not only nourishes your adrenal glands, but also supports a healthy blood sugar and blood pressure. It won't fix a bad marriage, but it's kind of like an antidote to stress. Schisandra interacts with a few medications, so do ask your doctor if it's right for you. I'll see you next time.
I'll never forget the first time I heard this diagnosis. Mycosis fungoides. Mycosis, fungus, fungoides. Is that a word? And of course, folks, it was lymphoma. It was a type of white blood cell lymphoma. It wasn't at all what I thought. Mycosis means fungus. Fungoides, fungus. Could it be? Let's study that a little bit. What is Mycosis fungoides? Mycosis fungoides, also known as Albert-Bazin syndrome or granuloma fungoides, is the most common form of cutaneous skin T-cell lymphoma. It generally affects the skin, but may progress internally over time, okay? Symptoms include, and I used to see this when I worked in dermatology all the time, a rash, a bump, a tumor, skin lesions, itchy skin. While the cause remains unclear, most cases are not hereditary. I love when they say, we don't know the cause, but we know it's cancer. And it's named Mycosis fungoides. Be still my ticker. Okay, let's study it. Who were Doctors Albert and Bazin? And how did their namesake disease get called Mycosis fungoides? Well, in the 1700s, mid-1700s, these were French dermatologists who probably got together for a bagel and a cup of joe and talked about patients who had similar conditions. They named this disease back then, folks, because of the way it looked. It looks like a fungal disease. It looks like ringworm growing on someone's arm. And somehow that ringworm became internal and it can kill, right? T-cell cutaneous skin, T-cell lymphoma, a bad disease. Mycosis fungoides, I looked this up. It's actually a mushroom-like fungal disease. The disease is a bloodstream lymphoma that mimics eczema and ringworm. Hence, it is mistaken for fungal diseases. Oh my gosh. Often seen in hidden areas of the body, like under your arms, groin areas, etc. Mycosis fungoides is characterized by lymphocytes in the skin instead of in the lymph tissue or the bloodstream. That was a long time ago, 250 years ago. These guys were saying, let's name it, I don't know, Mycosis fungoides. Okay, look at what it looks like. This was a long, it's actually a thin woman, but right there on the right side of her body is a patch, that red patch with a little arrow on it. And I thank ePain Assist for this. This website says the naming of Mycosis fungoides is quite misleading, and it has nothing to do with a fungal infection. Well, maybe, or maybe not. If I, my mom, my sister, my neighbor, someone I loved had this disease, I'd first think name, fungus. Oh no, it's cancer. Really? Do mycotoxins cause this disease? The possibility of some cofactors, says this journal, the Journal of Neurology, the possibility of some cofactors like neuromycotoxins, penicillin is one of them, being the real cause behind a large number of entities to be considered in AIDS, TSP, Sjogren's disease, fungoid, Mycosis fungoides, or T-cell leukemia, among others, regardless of their retroviral serological state, is becoming more and more likely and scientifically plausible. What this says, folks, in this big neurological journal, Mycosis fungoides could be due to a mycotoxin. Is it? Let's keep going. Toenail antifungal drug clears Mycosis fungoides. A case study involving a patient diagnosed with this has 4 lesion outbreaks of Mycosis fungoides that were not responsive to other drugs, and yet Sporanox, 200 milligrams a day for 7 days, and I quote, completely resolved the lesions. And additional lesions, when they developed, again, Sporanox resolved the condition. An antifungal drug that kills toenail fungus is helping a patient with Mycosis fungoides, and in the opening graphic, we don't know what causes this. A neurological journal says mycotoxins might. Penicillin. Penicillium is the mold. The mycotoxin it makes is called penicillin, many variations that we take all the time of that. And then this says Sporanox. Shouldn't all Mycosis fungoides patients be put on Sporanox? Not going to happen. If I had Mycosis fungoides, I'd ask my doctor to test the plaque lesions for fungus. I'd ask my doctor if I could follow the Kaufman-1 diet, and I'd request a prescription for 100 milligrams Sporanox and ask my doctor if I could take one twice a day for 7 days, of course, just as an experiment. Want that doctor to smile? Try that and go back to his office in a week or two and make him or her smile. Sometimes cancers are fungal diseases. That's been documented. Judy, I believe it all has to do with your take on preventive medicine. To a doctor, a flu shot is preventive medicine. For me, more vitamin C and beta-glucan is preventive medicine, so I don't need the flu shot because I may not get the flu. Okay, so why supplements over medicines? One, I take supplements to prevent the onset of illness. I believe in them. I've studied them for 50 years. I believe in them. Medication, would I take a medication? I did in 2017. You know my story. I was traveling, lecturing to doctors, one city after another, and on the way back to Dallas, the guy sitting in front of me had the flu and he was coughing and hacking, and I got home and got the flu. 3 days later, I was really sick, and I drove down to a little, what do they call those little medical stop clinics, and I paid $75, and I knew what I wanted. I asked for it, and I got an antibiotic, took it for a few days, and boom, it was gone. Medicines and supplements can both be life-saving. By the way, just a little tidbit. This wasn't true 50 years ago. Today, as many people take pharmaceutical medication as take nutritional supplements, they are having an impact. There are many people like me who believe the proper supplements, the right exercise program, right, and the right diet means I don't go on to get ill. I have once in the past 50 years been very ill with that flu I got 3 years ago. Short of that, I haven't been, and I don't take any medicines. But I do take my supplements. I do know that my exercise program and sweating helps detoxify, and that my diet means I'm not feeding microorganisms that can be involved in illness, including cancer. Fungi, certain fungi do make poisons that do induce cancer. So just be careful. You'll find your thumbprint. I take supplements so I don't have to take medicines. Many people on medicines today, I'm reading, are also taking supplements. Good for you guys.
Hi everyone, my name is Abby and I wanted to show you a quick little kitchen gadget that I have for you that'll make your life a little bit easier. We talk a lot about spiralized zucchini or zucchini noodles or stuff like that, but this is actually a handheld spiralizer that you can buy at like a Bed Bath & Beyond or a restaurant store. It's really easy to use. So you're just gonna take a clean zucchini, stick it in here, and just slowly twist it out. Now you've got some nice spiralized zucchini noodles, so why don't you go ahead and give this a try.
Isn't this fascinating? It's even better to note that you can play it again or forward it to your family. Maybe somebody needs to hear this, folks. That's why we do this show. It's been on the air 22 consecutive years. Why do I take supplements? Because in my 70s, I want to feel this good in my 80s. And regular exercise, diet, the proper diet, that has everything to do with it, and the proper supplements. So thank you for asking that question. Mycosis Fungoides, lymphoma or fungus? Isn't that fascinating the way things were named, back then? Gee, it's behaving like a fungus, but it is a cancer, really. Okay. Are we hyperdiagnosing certain conditions? Thank you so much, Dr. Stillman, for coming in today and talking about Lyme disease, okay? Susie, the adrenal glands, what a role they play in our good health or our failing health, as she brought up. And finally, COVID-19, mysterious, isn't it? It just couldn't be histoplasma DNA from a fungus merging with RNA from a virus, could it? That would be strange, but it could happen. God bless you, folks. See you next time.